Mr. Iwashita's mother died last January. She had heart problems, but this woman was above all a victim of what is now called the Japanese hospital's emergency room crisis.
We called an ambulance at 9:30 p.m. They arrived quite rapidly. At 9:45, my mother was inside the vehicle. Then, during half an hour, the ambulance man contacted hospitals. 11 hospitals turned them away. Finally, at 10:15 p.m., she was driven to a 12th hospital. We arrived quickly, but she died a few minutes later.
In one of the worst cases last year, it took 5 hours and 25 minutes before one ambulance could find a hospital that would accept a patient it was carrying. A survey conducted by the Fire and Disaster Management Agency shows that in 2007, 1,074 ambulances were turned away by at least 10 medical facilities. 60% of the cases occurred in Tokyo. Embarrassing statistics, but officials in charge remain tight-lipped.
I cannot answer. This issue is too vast. It doesn't only affect the fire department, but also the Ministry of Health and governmental agencies.
At issue is a lack of doctors willing to work overnight shifts, as they are paid only €4 an hour. There are other budgetary problems linked to the fact that 85% of hospitals are privately owned. In the last 2 years, 235 hospitals have shut down their emergency rooms, saying they were unprofitable.
The biggest problem is that neither the government nor the population understands that ERs are very expensive and do not bring in any money. They really are non-profit. There is an urgent need to increase budgets, notably because we are now suffering the consequences of former Prime Minister Koizumi's budget restrictions on health.
The Ministry of Health claims there is no healthcare crisis and therefore no reason to worry.
The issue is not about the reduction of the number of hospitals in itself, but the fact that each hospital has to increase its capacity and that patients who do not need intensive care have to go to clinics near their houses.
Actually, the authorities seem clueless. The ministry only says it will hire coordinators aiming at helping patients to reach the right hospitals. But maybe the main clue to the wider problem is this: the government's outlay for healthcare is 8% of Japan's GDP, one of the lowest figures among the world's developed countries.